Howdy y'all, I'm Dr. Isam with Lubbock Gastro. Today I'll explain what esophageal manometry is, which is a test that we do to check the pH levels of the esophagus to see if the lower esophageal sphincter is working correctly or not. We do an esophageal manometry to see the contraction of the esophagus. We want to see if it is contracting in a normal sequential pattern. Normally when we swallow, the esophagus will contract in a sequential manner from the top to the bottom, but in some individuals it may not work correctly. It may contract in an uncoordinated fashion, which can manifest as chest pain, trouble swallowing, or bad acid reflux. The manometry will allow us to determine exactly what's going on so we can get down to the root cause to get you feeling better. So what exactly is an esophageal manometry? Esophageal manometry is a thin tube, like a wire, that actually allows us to see the motility or the contraction of the esophagus. Now typically we do this for those individuals that have non-cardiac chest pain, trouble swallowing, or to assess if the esophagus may be playing a role when it comes to acid reflux. Commonly, esophageal manometry is also a test that we do prior to the workup to see if your hernia needs to be surgically fixed. Preparation is very simple. Usually we'll fast for a couple hours before the test, and you may be asked to stop certain medications. We'll give you instructions on this. There's no sedation required for this test, so you can drive yourself home after it's done. What exactly is going to happen during this procedure? We'll give you topical numbing medications so you don't feel what's going on. And we put a small little tube, we put it down your nose while you're awake for about 20 minutes. We have you swallow some water. I tell patients it's not a comfortable test, and it's not, but we have trained professionals. We're gonna make sure we can do this safely for you, make it as comfortable as possible, but also this is gonna allow us to give us the information that we need to get you feeling better. And as soon as the test is done, we'll remove that tube and you can go about your day. The test is generally safe and there's no sedation required. It is uncomfortable whenever we initially place the tube, but once again we'll give you a way to numb the area so you don't feel that discomfort. You may have a sore throat or some nasal irritation afterwards. And if you have significant discomfort, you can tell our staff to stop. After the test, you can typically resume normal activities, and because we don't give you sedation, you can drive yourself home. I'll review the results to give you the next steps to answer the questions to hopefully get you feeling better, but more importantly, get down to the root cause of why you're having your symptoms. If you have any trouble swallowing, if you're having bad acid reflux, you're having chest pain, and your heart's been ruled out, talk to us about whether doing esophageal manometry is right for you. To schedule an appointment to come see us, contact our office at Lubbock Gastro at 806-696-4440 or visit lubbockgastro.com for more information.